Casa Dona Juana is a no-profit organization. They have more than 22 years that was founded. And initially it was more for women, but with the years we now provide service for families and work also with the environment. So the focus in the last maybe 7 years is to work with seniors to provide different service to this group. We have we provide health promotion workshops. Also, we have as a recreation, we have 2 dancing groups, traditional dancing group, and these people, this group perform in different activities around the city to other seniors and to other community centers. There are more now we are like have traditional dancing from Peru and Bolivia. So the people, senior enjoy very much to dance and to show to the younger generation some traditional, the culture from our countries. So also we provide service for people when they need to attend have appointment in the hospital or appointment to the doctor. We provide interpretation service because most of the seniors, they are very hard to be with somebody to go with them because most of the time they have children are working and don't have time. So we provide a kind of service to be with the senior. Sometimes the volunteers stay like 3-4 hours in the hospital, like to help the senior to have sometimes a small procedure, something, in the hospital surgeries. So this is a very helpful program we have. We try to provide senior with a focus most like problems like information in different chronic disease, and we provide workshops on like the healthy heart to information about how to avoid the strokes, how live a healthy life, and also workshops on breast cancer, because another problem. Workshops, so now we start doing workshops on arthritis. This is one of the main problem with we saw the last survey that a lot of people complain that they have problem with arthritis. So we try to the first provide the information, and the second to provide some program that can benefit them. Like now we have the yoga program for yoga specialized to adults, so they can do yoga and sitting in a chair. And we need more program, like we would like to have dancing, and not they can come here to do some exercise, but still now we only have the yoga. So we provided before dancing, but people had to pay, and this is a very barrier to participate, because when it was free, we have 15, 20 people participating. When we start charging for class, we have 7, 8 people coming. Yeah. So this is a barrier for them to attend participate in programs. But the other is a problem, a health problem in our community, diabetes. So the last, I think 4 years, we are having a program for people with diabetes, a 4 weeks program. So in this program we provide information about the disease, and also how to control through food and to exercise, and they can control the glucose and how they can take care of them, control the diabetes, and live a healthy life. So this is, the program is expanding, because now I'm talking to other community centers that are interested in working with us, and to be more regularly, because this program is only once a year, but they are offering me like to come and maybe 2-3 times a year to do some work with us senior with diabetes. So because they don't want to go to program in English. This is the reason we start doing, even we are not community health center, but to doing the program here, because they complain. Even now, there is a lot of program around the city. Most of the community health centers have a diabetes program, but they don't like it. They don't want to go because they want to speak in Spanish. They want to ask questions. They don't want even with translator. So this is the reason that most of the time we try to have the program here. We have to try to do the workshops in Spanish or anything that they are interested in, we try to do it in Spanish. The people, since they come here is because they are independent. But what we try is to maintain these people healthy. That in the future they don't need to need more service. So they are learning to healthy food, how they can choose how they eat to stay healthy. We provide also the exercise program, recreation program. So we don't want these people in the future to stay for more time to stay healthy, and they can come here. We try even people come only to talk to other people or stay after the program because they are alone and they need to talk to other people, and this is the place, and this is they feel happy and comfortable to be with other people. So this is what we try to learn to prevent other disease, to go for checking, to be aware that they need, like they're getting older, they need to check for maybe for different disease, to go to different tests and to learn to eat more healthy so they can stay for more time. We don't need to stay home. So this is more the scene that they come here because they come here for the program. We don't do service to their homes. Mm-hmm. There are some, 2 or 3 seniors they come with using wheel trans, but they are able to move and to attend the program here. The problem with the funding sometimes is there is for a short period of time, like it's the whole year, and sometimes we got funding for 1 year and we don't have for other year. Like we start the community kitchen, and after 1 year there was no more money for community kitchen. But we at least when this program is with the people start paying for the food. So for the 5 years we work very well the community kitchen. But for other programs it's different because we have dancing program for 1 year. People are very involved with the coming, and they say the next year we don't have money for this year for dancing, and we have to pay for the instructor because it's the same person providing the service, and this is no more, they are not coming anymore because they have to pay for the transportation and they have to pay for the class. So this is the problem. Sometimes it starts very late in September, October. So we have only 5 months to 6 months to do some program. But the other program we do with volunteer, we provide internet classes for seniors with students that they come for doing the placement here for the college. So they come also to learn internet basic classes. That we do with volunteers. We try another program. We have also knitting and crochet classes that are free, provided for a volunteer, sewing classes. So they try to what they like and enjoy to do this kind of program. But sometimes it's not the funding for some other program because we need to pay an instructor for the class. We don't want to do it with a volunteer. With somebody that knows how to do it with senior, like the yoga, so people can benefit. Because it's that kind of program I can say, somebody wanna come, I wanna do the classes. We prefer to do somebody that really know and they can benefit from the program. We have No a formal partnership, but we work with other organizations that we work together. With Unison, we work, this is the community health center, it's across the street. We have like the community kitchen, 2 weeks here and 2 weeks in their place. And they support us in different way. And also like now with the diabetes program, they want to provide a dietitian to come to the program, and also some service for like a podiatrist, so we can refer our people with diabetes to have a check in the community health center. The other that help us is the community radio, Radio Voces Latina. They advertise and promote our program service in the radio so people can come and know what the program we have here. Yeah.
Okay.
And we before also we worked with St. Clair for Senior for many years. So we provided some work together in some programs. And they invited, and we invited, so we're very close with the organization. Yeah, and one time they help us with shopping. They provide the transportation for us to go shopping for the community kitchen for 2 years. So yeah, they are very supportive of our program. Yeah, I think that one other problem that we also provide the kind of service is. Because they are not fluent in English, they have sometimes very problem like communicating. Even the problem with they receive the bill for the telephone, and it's high. They don't know where to turn it, and they come here, and we help and make the call and ask the question. And all the time they have problems. You know, this time it's Roger or Bell or the tenant or this kind of problem, and nobody provides this kind of service for them. So even we are not part of our service, but we help them to do all this kind of referral. Referral with him. But most is they have reading letters, or they have to complain to somebody, or complain about the invoices of the bank or everything they need. We have to help them. It's not a service for that, or there's no program to provide this kind of service, but they need this. We will help them, even to cancel an appointment. Sometimes they come here and only to need somebody to make a call for them.